Nurse, please, the pain is unbearable. Help me.
You think I care about your credentials right now? This is my ward, my command. And I will not have it turned into a training ground for someone who still smells like orientation week. 20 years in uniform teaches you one thing: hesitation kills. Confusion kills. Incompetence kills. I've buried men who hesitated. I've written letters to mothers because someone thought they were ready when they weren't. So don't stand there quoting protocol to me. I know protocol. I helped write some of it. What I don't see is experience. I don't see deployment ribbons on your chest. I don't see time in the field. What I see is a junior nurse trying to override a direct refusal from a flag officer who is fully aware of his rights. You want respect in this building. You earn it. Not with textbooks. Not with confidence. And certainly not by challenging my authority in front of my staff. If you have something to say it clearly. If you have an order to give, make sure it outranks mine. And if you don't, step back. Because until I'm convinced otherwise, you're not leading anything in this room. Do you understand me? The Admiral didn't sit. He stood beside the hospital bed like it was a briefing table, one hand braced against the rail, the other gripping the thin cotton gown at his side as if it were a dress uniform he refused to let wrinkle. The heart monitor behind him kept a steady rhythm. Controlled. Measured. Like him. Around him, the room felt smaller than it was. 2 Marine security officers remained near the door, backs straight, eyes forward. Not because they were ordered to. Because that was what happened when a 4-star entered any space, even a military medical ward. Commander Evelyn Brooks stood 3 feet away, her Navy scrubs crisp, her rank insignia clipped neatly at her collar. She wasn't intimidated easily. 22 years in Navy medicine hardened most people. But even she kept her tone measured. Sir, with respect, your vitals are not stable enough for you to delay treatment. Admiral Marcus Hale didn't look at her. His gaze was fixed on the young nurse he'd just dressed down. Second Lieutenant Nora Carter. Brand new silver bars. Fresh-pressed uniform under a sterile gown. No ribbons yet beyond the standard commissioning awards. She looked young. Too young to challenge a man whose chest once carried more campaign ribbons than most sailors saw in their careers. The power imbalance in the room wasn't subtle. It was structural. Hale shifted slightly, the movement tight. Pain flickered across his face, then vanished just as quickly. Years of discipline buried it. I have refused 3 attending physicians, he said evenly. And now I'm expected to reconsider because a lieutenant junior grade thinks she sees something they don't. Second Lieutenant, sir, Nora corrected quietly. The correction was automatic. Professional. Not defiant. It didn't help her. The Marines at the door didn't react. But the corpsman near the monitor stiffened. Brooks stepped in before the temperature rose again. Sir, Lieutenant Carter was attached to a forward surgical unit in Kandahar during her clinical rotations. There it was. Subtle context. Not a resume. A breadcrumb. Hale's eyes moved, finally, to Nora. Kandahar, he repeated. Yes, sir. No elaboration. No speech about service. Just confirmation. The room hummed with fluorescent light. Outside the door, boots passed in the hallway, quick, disciplined steps. The medical wing of the Naval Hospital wasn't chaotic, but it wasn't quiet either. Radios crackled. Gurney wheels rolled. Orders were spoken in low voices. Inside this room, everything felt contained. Controlled tension. You're telling me, Hale said slowly, that a second lieutenant with clinical rotations believes she has identified something 3 board-certified physicians missed. Nora didn't look at Brooks. She didn't look at the Marines. She looked at the Admiral. Yes, sir. Her voice didn't shake. That, more than anything, shifted something in the air. Hale had spent 4 decades evaluating people under pressure. Subtle tells. Micro-hesitations. He knew fear when he saw it. She wasn't afraid. Young. Yes. And proven. Certainly. But not afraid. Commander Brooks folded her arms loosely, not defensive, just deliberate. Sir, she noticed a pattern in your cardiac rhythm that suggests intermittent conduction failure. It didn't present consistently during earlier scans. Hale's jaw tightened. And the cardiology department missed that. They didn't miss it, Nora said carefully. It didn't sustain long enough to flag. Silence. She had stepped into dangerous territory, not by being wrong, but by being precise. In military culture, precision from a junior officer can feel like challenge. Brooks watched the Admiral closely. The staff did too. Even the Marines shifted weight almost imperceptibly. This wasn't just a medical disagreement. It was hierarchy being tested. Hale turned slightly, wincing again before straightening. "Lieutenant," he said, voice lower now, "do you understand the gravity of countermanding a refusal from a flag officer?" "Yes, sir." "And you're prepared to justify it formally?" "Yes, sir." No bravado. No raised voice. Just certainty. Brooks saw it then, the shift in the Admiral's assessment. Not acceptance. Not yet. But recalculation. The heart monitor skipped. Just once. A tiny pause in rhythm. Every eye in the room flicked to the screen. It resumed immediately. Normal pattern. Except Nora's gaze lingered half a second longer than anyone else's. She stepped toward the monitor. Not dramatically. Not urgently. Just decisively. "With permission," she said. Hale didn't answer immediately. The room waited. This was the axis point, not dramatic enough for headlines, but heavy enough for consequence. Brooks broke the silence. "Sir, if she's wrong, the record will reflect that. If she's right, delay increases risk." The Admiral's eyes remained on Nora. He wasn't a man accustomed to being second-guessed. He commanded carrier strike groups. He made decisions that moved thousands of personnel across oceans. Now he stood in a hospital gown while a junior officer waited for his permission. Power looked different here. Quieter. 2 minutes, he said finally. "You have 2 minutes to show me something my cardiologist didn't." It wasn't approval. It was containment. Nora nodded once. "Yes, sir." She moved to the console, fingers steady as she replayed telemetry data. No grand gestures. No explanation yet. Just action. Behind her, Brooks allowed herself the smallest exhale. The Marines didn't move. The Admiral watched. And in that sterile room, beneath rank insignia, beneath history, beneath ego, something subtle had shifted. Not authority. Not yet. But perception. And in military see the telemetry finished replaying. Nora stepped back from the console. "It's subtle, sir," she said. "But it's there." Admiral Hale didn't move closer. He didn't need to. He had already decided what he was looking at. "I see artifact," he replied flatly. "Machine noise. Not pathology." Commander Brooks glanced at the screen, then at Nora. She saw the flicker, the pause in the rhythm that didn't belong. But Hale had already shifted his posture. Decision made. He turned toward the door. "Have cardiology notified I'll be discharging against medical advice." The corpsman near the monitor froze for half a second before nodding. "Yes, sir." The room tightened. Brooks stepped forward. "Sir, respectfully, discharge requires. I am aware of the regulation, Commander." His voice didn't rise. It sharpened. "And I will not have junior officers manufacturing complications to justify keeping me in a bed." The words landed deliberately. Not loud. Public. The door opened as another physician entered, Captain Roland Mercer, head of cardiology. Silver oak leaves at his collar. Calm, composed, older. He took in the room in one sweep. The Admiral standing. The nurse near the console. The tension. "Sir," Mercer began, "I understand there's been a concern." Hale gestured toward Nora without looking at her. "Lieutenant Carter believes she's discovered a condition 3 of your attendings failed to identify." There it was. No anger. Just exposure. Mercer's gaze settled on Nora. Not hostile. But assessing. "Lieutenant." She didn't glance at Brooks for rescue. She stepped forward. "Intermittent AV block, sir. Transient. It presents under minimal exertion and resolves before sustained capture." Mercer walked to the screen. Scanned the replay. Rewound. Watched again. The room had grown busier without anyone noticing. A pair of nurses lingered near the doorway. A petty officer delivering charts slowed his pace. The Marines remained statues. Public now. Hale folded his arms, a subtle dominance cue even in a hospital gown. Mercer straightened after a long moment. It's faint. Yes, sir, Nora replied. And inconsistent. Yes, sir. Mercer glanced at Hale. Sir, we can run a stress echo. 20 minutes. Hale's jaw tightened. I have a briefing with Fleet Command in 90. Sir, Brooks said evenly, Fleet Command can brief without you. Your heart cannot. Silence. The Admiral's gaze shifted, not to Brooks. To Nora. You understand what you're implying, he said. Yes, sir. That I am medically unfit for duty. If the block progresses under strain, she said carefully, it could compromise perfusion. No dramatics. Just fact. Hale took one step closer. The height difference wasn't dramatic, but the weight of rank was. You're prepared to document that recommendation? Yes, sir. The room could feel it now, the line she was stepping over. Recommending temporary removal of a 4-star from operational command wasn't just medical. It was political. Mercer cleared his throat softly. Sir, precautionary evaluation isn't removal. It's verification. Hale didn't respond to him. He kept his eyes on Nora. Lieutenant Carter, he said, voice lower now, do you know how many evaluations I've undergone in my career? No, sir. Hundreds. He let that settle. And none have suggested I step aside because of a flicker on a monitor. The nurses at the door shifted. One pretended to check a tablet. The petty officer left quietly. Public scrutiny without commentary. Nora's hands remained clasped behind her back, parade rest posture. Not submissive. Professional. With respect, sir, she said, none of those evaluations occurred while you were actively symptomatic. That did it. Not shouting. Not defiance. Precision. Hale's expression cooled. Commander Brooks, he said without breaking eye contact with Nora, remove Lieutenant Carter from my case. The words struck harder than a raised voice. Brooks didn't move immediately. That hesitation lasted less than a second, but it was visible. Sir, she is assigned to this ward. Not anymore. The Marines exchanged a glance so slight it would have been missed by anyone not trained to notice micromovements. Nora felt the shift physically, like air pressure dropping. This wasn't about medicine anymore. It was containment of challenge. Brooks stepped beside her. Lieutenant, wait outside. Nora held Hale's gaze 1 second longer than protocol required. Then she nodded once. Yes, ma'am. She walked toward the door. No slumped shoulders. No visible anger. But her jaw was set tight enough to show strain. As she passed the Marines, one of them adjusted his stance, a silent acknowledgement. Not support. Just awareness. The door closed behind her with a muted click. Inside the room, Mercer exhaled slowly. Sir, with respect, the lieutenant may not be wrong. Hale finally looked away from the door. Then you run your test, he said. And if it confirms her theory, I will address it. And if it doesn't? Mercer asked carefully. Hale's expression hardened. Then we will address why a junior officer thought it appropriate to question her superiors in front of half the ward. Outside the room, Nora stood rigid against the wall. Through the small window in the door, she could see the Admiral still standing. Still refusing the bed. Still in command. For now. Ultra perception is often the first crack in command. The hallway outside the Admiral's room felt colder than it had minutes earlier. Nora stood with her back against the wall, hands clasped behind her, eyes forward. Regulation posture. Still as the Marines inside. Across from her, a wall-mounted display cycled through patient vitals for the wing. Green lines. Stable numbers. Order. Inside room 314, voices were muted now. Lower. Controlled. Commander Brooks stepped out first. The door closed softly behind her. She didn't speak immediately. She studied Nora's face the way senior officers do, not searching for emotion, but for cracks in discipline. You understand what just happened, Brooks said quietly. Yes, ma'am. Do you? Nora didn't answer right away. Down the corridor, a gurney rolled past. Rubber wheels squeaking faintly. A corpsman pushed it without looking in their direction, but his pace slowed just enough to suggest he was listening. Brooks lowered her voice further. A flag officer's medical status is not just clinical. It's strategic. Yes, ma'am. And when you press a diagnosis in a public room, Brooks continued, you're not only challenging his health. You're challenging operational continuity. Nora held steady. Understood. Brooks watched her for another second. Cardiology is running the stress echo. Nora's eyes flicked once toward the closed door. That was the first visible tell. Brooks noticed. You're confident, the commander said. I'm concerned, ma'am. Not confident. Concerned. Careful word choice. Brooks gave a slight nod. Concern doesn't outrank stars. No, ma'am. Silence settled between them. Inside the room, something metallic clinked. Equipment being adjusted. The faint hum of a portable imaging unit powering up. 2 enlisted sailors at the far nurse's station were pretending to reorganize files. They had already reorganized them once. Their conversation was quiet, too quiet. Words clipped when either Brooks or Nora glanced over. The Marines remained posted at the door. One of them, Staff Sergeant Alvarez, according to the name tape, shifted his weight again. Not impatient. Calculating. He had been assigned to Admiral Hale for 3 years. Long enough to recognize patterns. Long enough to know the Admiral didn't refuse medical evaluation unless something felt personal. Nora caught his movement from the corner of her eye. He wasn't looking at her. He was looking at the floor. Jaw tight. That registered. Inside, the echo machine emitted a soft, rhythmic thrum. The kind that vibrates faintly through walls. Brooks checked her watch. 7 minutes. Longer than necessary. Captain Mercer emerged halfway through, speaking in low tones to a cardiology technician in the hall. His expression was neutral, carefully neutral. Nora straightened as he approached. Lieutenant, Mercer said evenly, you're still assigned to the ward. For now, sir. A pause. For now, he repeated. His eyes held hers for a second longer than professional courtesy required. Then he turned slightly away from Brooks, not enough to be obvious, but enough to create a small pocket of conversation. You said the irregularity presented under minimal exertion, he said. Yes, sir. And resolved quickly. Yes, sir. Mercer nodded once. Machines don't imagine patterns. No, sir. He didn't smile. He didn't confirm. He returned to the room without another word. Brooks exhaled quietly. You realize, she said to Nora, if this comes back clean, your record will reflect today. Yes, ma'am. Flag officer dissatisfaction travels. I know, ma'am. Brooks studied her again. You've been in uniform less than a year. Yes, ma'am. And yet you were willing to recommend evaluation that could sideline the Pacific Fleet's senior operational commander. The title hung in the air. Pacific Fleet. Not a hospital patient. Not just a 4-star. A strategic asset. Nora's throat moved once as she swallowed. I recommended a test, she said carefully. Brooks's gaze sharpened. Not denial. Precision. From inside the room, a sharper tone sounded, not an alarm, just a change in machine cadence. Brooks's head turned toward the door instantly. The Marine straightened. Then silence again. The machine resumed its steady rhythm. Too steady. Nora's eyes narrowed almost imperceptibly. Too steady. Staff Sergeant Alvarez noticed that look. He shifted his stance and finally spoke, voice low. Ma'am. Brooks turned slightly toward him. With respect, Alvarez said, the Admiral's been off. Brooks waited. Past month, he continued. Shorter fuse. More headaches. He stopped there. Not overstepping. Just offering data. Brooks glanced at Nora. Nora didn't react outwardly. But her hands tightened behind her back. Why wasn't that reported? Brooks asked. Alvarez's jaw flexed. He told us it was stress. That tracked. Flag officers carried pressure like armor. Inside the room, the door opened again. Mercer stepped out. This time, he closed it behind him completely. That was new. His face remained composed. Professional. No urgency. But there was something restrained in his posture. Shoulders slightly set. Chin lowered half a degree. He addressed Brooks first. Commander. A word. They stepped several feet down the corridor. Far enough for privacy. Not far enough to avoid attention. Nora stayed where she was. Alvarez's eyes followed Mercer. The two sailors at the nurse's station stopped pretending to reorganize. Mercer spoke in low tones. Too low to hear. Brooks's expression didn't change at first. Then it did. Not dramatically. Just a slight tightening around the eyes. A micropause before she responded. She glanced back at Nora. Just once. Then returned her focus to Mercer. They spoke for another 20 seconds. Measured. No raised voices. No visible alarm. When they finished, Brooks walked back alone. Mercer re-entered the room. Brooks stopped in front of Nora. For a moment, she said nothing. The hallway felt narrower. You're not to discuss this outside this corridor, Brooks said quietly. Yes, ma'am. The results are inconclusive. Nora's eyes flickered. Inconclusive how, ma'am? Brooks held her gaze. Intermittent conduction delay was observed. Not confirmed. Observed. Careful language. Nora didn't exhale. She didn't smile. She simply nodded once. Inside the room, there was movement, heavier now. The subtle shift of someone lowering themselves onto a bed after resisting it for too long. The Marines heard it. Alvarez's jaw unclenched just slightly. Brooks continued, voice steady. Further monitoring is required. And the Admiral? Nora asked. Brooks's pause this time was longer. He's agreed to remain under observation. Agreed. Not ordered. Not convinced. Agreed. Through the door's small window, Nora could now see him seated on the edge of the bed. Not standing. Not towering. Seated. His shoulders were still straight. His gaze forward. But he was no longer upright by choice alone. The monitor behind him displayed steady rhythm. Green lines. Calm. Almost too calm. Nora's attention lingered on the screen again. Something about the spacing between beats felt off. Not dramatic. Not obvious. Just enough to unsettle. Alvarez followed her gaze. You still see something, he said quietly. Nora didn't answer. She kept watching the monitor through the glass. The rhythm held. Precise. Disciplined. Like the man attached to it. But discipline can mask strain. And sometimes, the most dangerous failures are the ones that present as stability. Inside room 314, Admiral Marcus Hale sat on the edge of the bed, staring straight ahead. Listening. Not to the doctors. Not to the machines. But to something internal. And for the first time since he had entered the hospital, he wasn't entirely certain it was under his command. Night settled over the Naval Hospital in layers. By 2100, the corridor outside room 314 had quieted. Foot traffic thinned. Conversations lowered. The fluorescent lights dimmed slightly to their overnight setting, casting longer shadows across polished floors. Admiral Hale remained under observation. He had insisted on sitting upright for hours. At 2117, he finally allowed the bed to recline 10 degrees. Not because he was tired. Because Captain Mercer had phrased it carefully, improved waveform visibility, sir. Language mattered. Inside the room, the monitor continued its disciplined cadence. Green lines. Regular spacing. Clean. Almost clean. Nora stood at the nurse's station now, reviewing telemetry remotely. Officially, she was no longer assigned to his case. Commander Brooks had reassigned her to general ward coverage for the evening. Unofficially, no one had told her to stop watching. On her screen, the Admiral's rhythm scrolled in steady motion. Every 30 to 40 beats, there. A fractional delay. So small it looked like latency. Then it corrected. A near miss. If someone wasn't actively looking for it, it disappeared into normal variance. Staff Sergeant Alvarez approached the desk quietly. He had removed his cover and tucked it under his arm, posture still rigid even in partial rest. He asked for you, he said. Nora didn't look up immediately. I'm not assigned to him. He didn't ask for assignment. That made her pause. She glanced down the corridor toward room 314. Through the small window, she could see the Admiral's silhouette against the dim lighting. Still upright. Still composed. Watching the door. Did he specify why? She asked. Alvarez's jaw shifted. No, ma'am. Ma'am. Not lieutenant. Not nurse. Ma'am. Small change. She logged out of the telemetry terminal and walked toward the room. Inside, Hale's gaze met hers the moment she entered. Captain Mercer stood near the foot of the bed, reviewing a tablet. Commander Brooks leaned against the counter, arms folded. No one spoke for several seconds. "You're still observing the monitor," Hale said finally. Not a question. "Yes, sir." "You're no longer assigned." "No, sir." "Yet you continue." "Yes, sir." Silence. Mercer glanced up briefly. Brooks didn't move. Hale studied her face the way he might study a junior officer during an inspection. "Tell me what you see," he said. Mercer shifted slightly. Brooks's posture straightened a fraction. Nora stepped closer to the monitor. "Intermittent delay persists, sir," she said. "It's compensating." For now." "For now," Hale repeated. "Yes, sir." Mercer cleared his throat. "We've scheduled extended telemetry overnight." Hale didn't look at him. He kept his attention on Nora. "You said earlier," he continued, "that this presented under minimal exertion." "Yes, sir. And I have not exerted myself." It wasn't defensive. It was analytical. Nora hesitated. Not from doubt. From calibration. "With respect, sir," she said, "command stress is exertion." The room stilled. Brooks's eyes flicked to Hale. Mercer stopped scrolling. Hale's expression didn't change. But something in his shoulders shifted. "You believe my condition is stress-induced," he said evenly. "I believe stress is a trigger, sir." "And you're basing that on telemetry alone?" "No, sir." Another pause. Brooks's gaze sharpened. Mercer looked up fully now. Hale's eyes narrowed slightly. "Then on what?" Near-miss moment. This was where a junior officer might overstep. Where ambition might show. Where ego might leak through. Nora held his gaze. "On pattern," she said. "What pattern?" "You're compensating before the delay occurs." Silence. The monitor continued its quiet cadence behind her. Hale's voice lowered half a degree. "Explain." "You anticipate strain," she said carefully. "Your breathing adjusts before waveform disruption. Your posture shifts before the delay registers." Mercer frowned faintly. "That's speculative." "Yes, sir." "But consistent." Brooks pushed off the counter slowly. Hale's eyes never left Nora. "You're telling me," he said, "that I'm masking a physiological event." "Yes, sir." The Marines at the door exchanged the slightest glance. Hale leaned back against the raised bed. "Not surrender. Evaluation." "And how," he asked, "would you know what masking looks like?" There it was. The edge beneath the question. Not accusation. Interrogation. Nora's jaw tightened briefly. Another near miss. She could say too much. Or too little. "I've seen it before, sir." "Where?" "In training." "Clinical training," Mercer interjected. Nora didn't look at him. "Yes, sir," she answered Hale. The answer was technically true. Brooks watched her carefully. Hale's gaze sharpened. "Training doesn't teach you anticipation cues like that," he said. "No, sir." The admission hung in the air. Mercer looked between them now. Brooks's eyes narrowed slightly. Hale's fingers tapped once against the bed rail. "You're speaking from observation," he said. "Yes, sir." "Of whom?" Another near miss. The monitor skipped barely. Recovered instantly. Nora didn't glance at it. She kept her focus forward. "Patients under operational command," she said. Mercer's brow furrowed. "You were attached to Kandahar in a student capacity." "Yes, sir." "And you observed operational command masking arrhythmia there." Mercer pressed. Nora didn't answer immediately. The silence stretched just long enough to create weight. Brooks stepped forward slightly. "Captain," Hale lifted one hand subtly. Brooks stopped. He was still in control of the room. "For a student," Hale said quietly, "you speak like someone accustomed to command rooms." Not praise. Not accusation. Recognition. Nora didn't react outwardly. "I speak from what I've seen, sir." "And you're certain you've seen this before?" "Yes, sir." The room settled into a different kind of tension. Not conflict. Curiosity. Hale studied her for a long moment. Then he shifted his gaze to Mercer. "Extend monitoring," he said. "It's already scheduled, sir." "Double it." Mercer nodded once. "Yes, Admiral." Hale returned his attention to Nora. "You will remain available," he said. Brooks's eyebrows lifted slightly. Nora held steady. Yes, sir. Not reinstated. Not acknowledged. But no longer dismissed. As she turned to leave, the monitor behind her displayed another fractional delay. Compensated. Masked. Corrected. Near miss. In the hallway, Alvarez fell into step beside her for 2 paces before stopping. He doesn't double monitoring, he said quietly. Nora didn't slow. He did tonight. She walked back toward the nurse's station. Behind her, inside room 314, Admiral Marcus Hale stared at the ceiling. Not at the monitor. Not at the doctors. But at the memory of the way she had described anticipation. Masking. Like someone who had not merely studied it, but lived around it. And for the first time since entering the hospital, he wasn't evaluating a junior nurse. He was trying to determine what he didn't yet know about her. At 0238, the monitor changed. Not dramatically. Just enough. The steady cadence that had held all evening fractured into a staggered rhythm, a delay that didn't compensate fast enough. Inside room 314, Admiral Marcus Hale's hand tightened on the bedrail. Captain Mercer was mid-sentence when the waveform dipped again. Longer this time. The soft mechanical tone sharpened. Commander Brooks stepped forward instantly. Sir. Hale didn't answer. His jaw locked. His shoulders squared as if posture alone could override physiology. The monitor skipped. Recovered. Skipped again. This time it didn't correct cleanly. Nora was already moving. She hadn't been in the room. She'd been at the station, watching remotely, waiting for the pattern she knew would escalate under fatigue. The door burst open before anyone called her. Staff Sergeant Alvarez stepped aside without being told. Inside, Mercer was reaching for the emergency cart. Brooks was issuing controlled orders. Prepare atropine. Get respiratory on standby. Hale tried to swing his legs off the bed. I am not, he began. The waveform dropped sharply. For half a second, the room held its breath. Then chaos, but disciplined chaos. Mercer moved to administer. Nora's voice cut through it. Stop. Not loud. Not panicked. Precise. Every movement in the room paused, not because of her volume. Because of her tone. Mercer turned sharply. Lieutenant, stand back. That will destabilize conduction, she said evenly. Brooks shot her a warning look. This is not your case. The monitor dipped again, deeper. Hale's vision blurred for a fraction of a second. He steadied himself with visible effort. Nora stepped closer to the bed. Sir, she said. Not to Mercer. Not to Brooks. To him. Look at me. Mercer bristled. Lieutenant, Admiral, she said, ignoring the interruption. Focus on my voice. Hale's eyes snapped to hers. Authority met authority. In that locked gaze, something unspoken passed. Slow your breathing, she instructed quietly. 4 counts in. Hold. 6 out. Mercer stared at her as if she had crossed into insanity. This is cardiac failure, not yoga. Not yet, she replied without looking at him. The monitor stuttered again. Hale inhaled sharply. 4, she said calmly. He obeyed. Not because she outranked him. Because her tone assumed compliance. Hold. The room was silent except for the monitor. 6 out. His shoulders lowered slightly. The next beat came cleaner. Mercer froze mid-reach for the syringe. Brooks watched the waveform. Another breath. Another controlled exhale. The rhythm steadied incrementally. Not perfect, but stabilizing. Mercer lowered the syringe slowly. This is transient vagal compensation, Nora said evenly. Chemical intervention will overcorrect. The monitor continued to normalize. Hale's grip on the rail loosened. The Marines at the door hadn't moved, but the air around them had shifted. Brooks stepped closer to Nora. Explain, she demanded quietly. Nora didn't break eye contact with Hale. Sir, she said softly, you trained yourself to override adrenaline spikes. Hale's breathing remained controlled. Yes, he said after a moment. The admission was quiet. Brooks's eyes sharpened. You're countermanding the body's warning, Nora continued. You don't yield to it. You force rhythm. Another beat. Clean. Another. Stable. Mercer looked at the monitor, then at Nora. You're saying he's suppressing a sympathetic cascade? Yes, sir. With what training? Silence. The waveform steadied fully now. Green lines smoothing. The crisis window closing. Hale's color returned gradually. His eyes never left Nora. With what training? Mercer repeated, firmer. Nora finally shifted her gaze, not to Mercer, to the Marines. Specifically, to Alvarez. A flicker of recognition crossed his face. She turned back to Hale. Permission to speak freely, sir. Brooks inhaled sharply. Mercer blinked. Hale studied her. You have it. The room felt suspended. Nora reached up slowly and unclipped the small, unremarkable badge attached beneath her name tape, the one most staff assumed was administrative clearance. She held it between two fingers. Not dramatically. Simply visible. Alvarez stepped forward instinctively. Mercer frowned. What is that? Hale's eyes dropped to the insignia. His expression changed. Not confusion. Recognition. Immediate. The smallest shift in posture, but unmistakable. Where did you get that? He asked quietly. Naval Medical Special Operations Program, sir, she replied. Brooks's head turned sharply. That program was dissolved. No, ma'am, Nora said calmly. It was restructured. Mercer looked between them. Special Operations, Embedded Cardiac Stress Response Research, she said. Joint with Naval Special Warfare. Alvarez's jaw tightened. Hale sat fully upright now. You were embedded, he said. Yes, sir. Under whose authority? She met his gaze evenly. Yours. The words landed without force. But the impact was seismic. Brooks took a step back unconsciously. Mercer's tablet lowered. Alvarez's posture shifted, not defensive. Respectful. Hale's eyes narrowed slightly as memory recalibrated. Codename, he said quietly. Nora held his gaze. Echo 7, sir. The room went still. Completely still. Even the monitor seemed quieter. Hale exhaled once, not from weakness. From understanding. He remembered the briefings. The classified pilot program studying autonomic suppression in high command officers during combat operations. Anonymous embedded medical observers. Limited clearance. He had signed the authorization. Years ago. He had never expected to meet one face-to-face. You were observing command physiology, he said. Yes, sir. And you never disclosed. It wasn't required, sir. Mercer's voice came out lower now. Commander Brooks. Brooks didn't answer. Her eyes were fixed on the Admiral. Because his posture had changed. Not physically. Authority remained. But the dynamic in the room had inverted. He was no longer evaluating a junior nurse. He was addressing an asset he had personally sanctioned. You recognize the pattern, he said. Yes, sir. Because you've monitored officers trained to suppress autonomic failure. Yes, sir. Another beat passed on the monitor. Clean. Steady. Hale glanced briefly at Mercer. No atropine, he said calmly. Mercer nodded immediately. Yes, Admiral. Immediate compliance. Brooks straightened fully now. Lieutenant Carter, she began. Echo 7, Hale corrected quietly. Brooks stopped. Alvarez's chin lifted a fraction higher. Hale swung his legs fully back onto the bed. Not resisting now. Choosing. Extended monitoring stands, he said. Yes, sir, Mercer replied. Hale's gaze returned to Nora. You will remain on this case. Brooks didn't object. Mercer didn't question. Alvarez stepped back into formal stance, but there was something different in it now. Acknowledgement. Hale held Nora's eyes for one final moment. Next time, he said evenly, lead with the codename. A faint pause. With respect, sir, she replied, next time I won't need to. The corner of his mouth shifted, not a smile. Recognition. Around them, behavior had already changed. Mercer stood straighter when addressing her. Brooks's tone recalibrated. Even the Marine's posture carried subtle deference. No announcement had been made. No speech delivered. Just a badge. A codename. And the memory of an authorization signed years ago by the man now lying in that bed. The power reversal wasn't loud. It didn't require shouting. It required recognition. And in that sterile hospital room at 0247 hours, everyone understood exactly who she was. By 0600, the hospital had returned to its disciplined morning rhythm. Shift changes. Coffee cups. Low-voiced reports at the nurse's station. Room 314 was no longer a spectacle. The crisis had stabilized overnight. Admiral Hale's telemetry remained under continuous observation, and the conduction delay, now formally documented, was being evaluated by a joint cardiology consult. No one spoke about 0247 hours openly, but everyone remembered it. Captain Mercer delivered his morning briefing with unusual precision. Intermittent second-degree AV block confirmed under fatigue threshold, he said, voice clinical. Non-ischemic. Stress amplified. Treatment plan under review. No mention of atropine. No mention of interruption. He did not look at Nora directly, but he did not avoid her either. Professional recalibration. Commander Brooks handled the administrative adjustments personally. Lieutenant Nora Carter was formally reinstated to Admiral Hale's case. Not promoted. Not reassigned. Simply placed exactly where she had been, this time without objection. Brooks signed the addendum with steady handwriting. You understand, she said quietly once the paperwork was complete, that clearance like yours complicates a standard chain of command. Yes, ma'am. You also understand that withholding it escalates conflict. Yes, ma'am. Brooks studied her for a moment. You made a judgment call. Yes, ma'am. A pause. It was correct. That was all. No apology. No praise. Just acknowledgement. Across the corridor, Staff Sergeant Alvarez stood outside room 314 again. Same position as the night before. When Nora approached for morning rounds, he opened the door without waiting for instruction. A subtle shift. Inside, Admiral Hale was seated upright in the bed, reading from a secured tablet. He looked composed. Rested. But there was a difference. He acknowledged her presence before she spoke. Lieutenant, he said evenly. Not Echo 7. Not nurse. Lieutenant. She stepped inside. Sir. Captain Mercer stood near the monitor, reviewing updated data. He nodded once to her small, professional respect. No hostility. No defensiveness. Just adjustment. Hale set the tablet aside. I've reviewed the overnight findings, he said. You were correct. The words were delivered without flourish. In military culture, that was significant. Nora inclined her head slightly. Thank you, sir. I will be placed on restricted operational status pending intervention, he continued. It wasn't anger. It was fact. Fleet Command would adapt. Deputies would assume temporary responsibilities. Briefings would be redistributed. Strategic inconvenience. Professional consequence. Hale's gaze sharpened slightly. You understand the impact? Yes, sir. And you're comfortable with it? It wasn't an accusation. It was evaluation. I'm comfortable with you remaining alive to return to command, sir. A faint silence followed. Mercer suppressed the slightest hint of a smile. Hale studied her, then nodded once. Alvarez remained at the door, posture firm, but his stance carried something quieter now. Trust. The hospital did not explode with rumors. There were no commendations issued that morning. No dramatic hallway applause. Instead, there were meetings. Closed-door conversations between medical leadership and operational command. Discussions about stress thresholds in high-ranking officers. Review of embedded medical programs that had faded into administrative obscurity. Nora was not summoned for congratulations. She was called for documentation. 3 hours of it. Formal reports. Pattern analysis. Recommendations for structured monitoring of flag officers under high operational load. It was meticulous. Clinical. Important. By afternoon, Fleet Command had issued a brief internal memo. Admiral Hale would remain temporarily hospital-bound for observation. No cause listed. No elaboration. Professional containment. In room 314, Hale prepared for another round of testing. Before the cardiology team entered, he looked at Nora again. You withheld your identifier until it became necessary, he said. Yes, sir. Why? She considered the answer. Because if the data wasn't enough, the codename wouldn't be either. A long pause. Hale absorbed that. Outside the room, Brooks watched through the glass. Not suspicious. Evaluating. Hale exhaled slowly. You were correct about something else, he said. Yes, sir. Command stress is exertion. The admission was quieter this time. Personal. Nora didn't respond with reassurance. She simply nodded. The monitor behind him displayed steady rhythm. Still imperfect. Still under review. But no longer denied. When she stepped out of the room, Alvarez gave a slight nod, not exaggerated. Respect between professionals. At the nurse's station, routine resumed. Charts updated. Medications logged. Orders processed. No one treated her like a hero. They treated her like someone whose authority had been clarified, which, in the military, was far more enduring. And inside room 314, Admiral Marcus Hale sat back against the raised bed, not resisting the angle this time. Not masking. Just breathing. 4 counts in. Hold. 6 out. Deliberate. Measured. Alive. The hospital wings had returned to routine, but the echoes of the previous night lingered in ways subtle enough that most would never notice. The fluorescent hum, the rhythm of gurneys rolling along polished floors, the faint clatter of charts being organized, all of it was ordinary, yet it carried the weight of what had transpired in room 314. For those who had been there, even peripherally, the shift in authority, perception, and understanding was undeniable. Lieutenant Nora Carter moved through the corridors with her usual precision, every step measured, every gesture controlled. Her uniform remained immaculate, her posture strict, her demeanor professional. But there was a quiet gravity about her now, a sense that she had crossed a threshold, one that did not require announcement or ceremony. It was the kind of acknowledgement that doesn't appear on a record, but it shapes every interaction thereafter. Commander Brooks watched her from a distance, taking note of the way Nora handled the morning rounds. There was no overt deference in the junior officer's actions. There was only competence, the kind that demands attention without demanding applause. Brooks understood, now more than ever, that respect in a military context was earned not by rank alone, but by consistency under pressure. It was subtle. It was disciplined. It was unshakable. Staff Sergeant Alvarez, stationed at the doorway to room 314, adjusted his stance slightly as Nora passed. Not a salute. Not recognition. Just a small, instinctive acknowledgement, the kind of acknowledgement shared between people who understand what it means to observe, to anticipate, and to act without hesitation. In the military, these moments carry weight. They communicate trust where words are insufficient. Inside room 314, Admiral Marcus Hale sat upright against the hospital bed, watching the monitor with a quiet focus. His chest rose and fell in a rhythm both disciplined and deliberate. The fractional AV block that had defined the crisis of the previous night remained under observation, but the near misses had been reduced. Intervention was no longer immediate. Anticipation had become management. Hale's breathing, his posture, even his eyes reflected a controlled understanding of his own physiology. Years of command had taught him to evaluate others, and last night had reminded him that evaluation works both ways. He looked at Nora once she entered the room, not with surprise, not with challenge, but with recognition. Recognition of competence, yes, but also of discretion, judgment, and the kind of quiet authority that does not need to assert itself verbally. In her restraint, he saw a reflection of the same principles he had spent decades enforcing: discipline, observation, and unwavering adherence to duty. There were no speeches, no dramatized confessions. Just a series of small actions, a nod of acknowledgement, the slight adjustment of a tablet, the deliberate recalibration of the monitor. These subtle shifts, unnoticed by those outside the hospital wing, were the markers of consequence. Professional consequences, yes, but also emotional consequences, a reshaping of how authority is perceived and exercised. Outside the room, the ward resumed its rhythm. Nurses moved efficiently between patients. Corpsmen carried out orders without commentary. The hum of fluorescent lights, the faint whir of ventilators, and the muted conversations of staff created an ordinary backdrop that contrasted sharply with the intensity of what had occurred just hours before. And yet, The memory of the night persisted quietly among those who had been witnesses. Admiral Hale considered the implications as he prepared for the next evaluation cycle. It was not fear that he felt. It was acknowledgement. A recognition that the rules of engagement, for leadership, for authority, for command, extend beyond experience alone. They require discernment, humility, and the ability to recognize capability even when it is concealed beneath youth, rank, or inexperience. Lieutenant Nora Carter moved with purpose through the ward, attending to her duties with unwavering focus. She did not flaunt her authorization, her codename, or her embedded experience. She did not need to. The subtle recalibration of authority, once complete, needed no reinforcement. Her colleagues responded with professional respect. Her actions no longer carried the tension of challenge. They carried only trust, tempered by the understanding that competence under pressure is its own form of authority. Commander Brooks observed from the nurse's station, reflecting quietly on the lessons embedded in the events of the previous night. Authority is not static. Respect is not granted simply because of insignia or years of service. True command is measured not only by decision-making, but by the capacity to recognize skill, to allow discretion when warranted, and to restrain judgment until observation confirms competence. In this way, leadership becomes both a science and an art, informed by structure but enlightened by experience. Staff Sergeant Alvarez, returning to his post, felt the shift in the room subtly, almost imperceptibly. The atmosphere carried a quiet tension that had been replaced by a deeper, more enduring order. It was the kind of order that does not require loud proclamations. It is recognized in posture, in measured steps, in the unwavering focus of those whose judgment is trusted. Even Captain Mercer, the head of cardiology, adjusted his professional interactions. He no longer issued directives in the same clipped tones when addressing Nora. Instead, he spoke with careful precision, his words measured, his demeanor respectful. It was not compliance out of fear or deference, but acknowledgement of capability, the kind that comes from witnessing judgment exercised under conditions few could endure. Hale considered the broader implications. A single night had reinforced lessons he had learned through decades of command, that respect must be observed in practice, that authority is validated through recognition of skill, and that humility is often the defining measure of leadership. In acknowledging Nora Carter, he had acknowledged both the limits and the responsibilities inherent in his own position. The ward continued its routine, the hum of equipment and quiet footsteps carrying the rhythm of a normal morning. Yet beneath that ordinary cadence lay the subtle understanding that authority is not always visible, that competence may reside where it is least expected, and that recognition, quiet, disciplined, and restrained, can shift the balance of command more effectively than any order, reprimand, or overt display of power. As Lieutenant Carter moved toward the telemetry station, she glanced briefly toward room 314. Hale sat upright, fingers lightly resting on the rail. No words were exchanged. The acknowledgement had passed silently between them. It did not need reinforcement. The room, the ward, and the staff had all adjusted imperceptibly to a new understanding. Respect earned through capability is a force stronger than any title, rank, or insignia. And as the morning light filtered through the hospital windows, reflecting off the polished floors, one could sense the quiet truth of the events. In the interplay of authority and competence, the greatest power lies not in assertion, but in the recognition of skill, the kind that waits patiently, observes keenly, and acts decisively when the moment demands. No one outside room 314 would fully understand it. Few inside would articulate it. But the lesson endured. And in that silence, as the monitors hummed steadily and footsteps continued their measured rhythm, it lingered. Authority tempered by respect, humility, and recognition leaves a mark far deeper than any command ever could.